Welcome to our deep dive into the world of psilocybin and depression.
Yeah,
You've given us a collection of research articles and studies, and
yeah,
we're really excited to dig into it.
absolutely.
So we're focusing on psilocybin as a potential treatment for depression.
Right, and especially looking at those really tough cases of depression.
Yeah.
And we're going to explore how the dosage and a patient's history might play a role.
Okay, cool. So we've got those magic mushrooms that everyone is talking about these days,
Yay!
and the active compound is psilocybin, and it's getting a lot of attention right now.
Yeah, it
It
is.
has a long history, doesn't it?
Yeah, psilocybin research actually isn't new. It was a hot topic back in the mid 20th century,
Mm.
and scientists were already exploring its potential for therapy back then.
What happened? Why did all that research stop?
Well, you think back to the 1960s, psilocybin and other psychedelics sort of got swept up in that whole counterculture movement,
Yeah.
and that led to a lot of legal restrictions and basically put the brakes on a lot of the research.
Hmm. But luckily, though, we are seeing a resurgence in recent years as researchers are revisiting its potential for mental health.
So it's like psilocybin is getting a second chance,
Yeah.
but this time it's all about science and medicine.
Exactly.
That's pretty exciting.
Yeah, it is.
So where does depression fit into all of this?
Well, there were two groundbreaking studies that came out in 2016, one by Griffiths and one by Ross.
Wow.
They looked at psilocybin's effect on depression and anxiety in patients who had life-threatening cancer.
Hmm.
What makes these studies so compelling is that they were designed to be extra reliable.
What makes them so different?
Well, they use what's called double-blind design. So neither the patients nor the researchers knew who was getting psilocybin and who was getting a placebo.
Hmm.
And they even used an active control substance
Oh,
and
wow.
just a sugar pill.
Okay.
So this makes the results much more convincing.
So it wasn't just like the power of suggestion or something like that.
Right.
We can be more certain that the positive effects they saw were due to the psilocybin.
So what kind of effects were they seeing?
Well, the results were pretty amazing. They
Okay.
saw significant reductions in symptoms and really fast, too.
Wow.
Sometimes those reductions in symptoms would last up to 6 months.
Wow.
Imagine, facing a life-threatening illness and dealing with all that depression and anxiety,
Yeah.
and then finding relief like that quickly. It's powerful stuff.
Yeah, that's incredible. How does it work? I mean, it's not like taking an aspirin or something.
Right.
How does some compound from a mushroom go into your brain and help with depression?
Yeah, it's really fascinating, and it's really different from how traditional antidepressants like SSRIs work.
Okay.
So SSRIs, they indirectly increase serotonin levels in your brain. But the thing is, SSRIs can take weeks or even months to really have a noticeable effect.
Yeah, I've heard that about SSRIs.
Yeah.
You have to wait weeks or months to feel any benefit.
Exactly. And it can be really frustrating for people who need relief now.
Of course.
But psilocybin's active form is called psilocin, and psilocin directly activates specific serotonin receptors in the brain, particularly this one called the 5-HT2A receptor.
Okay.
And it's this direct action that researchers think might be why it works so quickly.
So it's sort of like a shortcut to feeling better.
Yeah, you could say that.
Hmm.
And researchers are also looking into whether this direct action could explain those long-lasting effects that we observed in the studies.
Yeah.
One theory is that it could lead to what's called downregulation.
Okay.
And that means that the brain becomes less sensitive to serotonin over time. And this might actually be a good thing in this case.
I thought downregulation was bad.
Well, not necessarily. It's possible that this downregulation is part of why psilocybin has such a more lasting effect compared to SSRIs.
Okay.
So, think about it. Relief from depression that could last for months instead of having to wait and see if an SSRI will even work.
Yeah, there's a lot of potential there.
Mm-hmm.
But those studies you mentioned focused on cancer patients.
Right.
What about using psilocybin for other types of depression?
Well, that's where things get even more interesting. Evidence is suggesting that psilocybin might actually be effective for a much wider range of depression.
Hmm.
Even what's called treatment-resistant depression, which is notoriously difficult to treat.
So these are cases where maybe the traditional antidepressants just haven't worked.
Exactly. There was a 2016 study by Carhart-Harris that showed some promise,
Yeah.
but the participants in the study knew they were getting psilocybin.
Uh-huh.
So it wasn't quite as scientifically rigorous.
Okay.
But a newer study, a meta-analysis actually from 2023 by Perez,
Okay.
focused on finding the best dose of psilocybin for different types of depression.
And dosage keeps coming up. It
Yeah.
sounds like it plays a big role.
It really does.
So is there like a magic number when it comes to dosage?
I wish it was that simple.
Yeah.
What's fascinating is they actually found what's called a dose-response association.
Hmm.
So to a point, a higher dose led to a better response.
Okay.
But here's the twist.
Okay.
The ideal dose actually changes depending on the type of depression you're dealing with. So they defined primary depression as depression that wasn't caused by another medical condition,
Okay.
whereas secondary depression is depression that's a result of something else, like, a serious illness.
Right. So it makes sense. It's not one size fits all when it comes to depression.
Exactly. And they found that for treatment-resistant depression, higher doses were indeed more effective.
Okay.
But for secondary depression, there was sort of a sweet spot.
Mm.
And too much psilocybin was actually less helpful.
That's interesting. So there's like a right dose and a too high dose, depending on the person and their type of depression.
Exactly.
It sounds like finding that right dose is critical.
It is, absolutely.
Yeah.
But I think we also need to address the elephant in the room, or maybe we should say the magic mushroom in the room,
Okay.
and that's the actual experience of taking psilocybin.
Yeah.
We're talking about altered states of consciousness. We're talking about mystical experiences.
Yeah.
Things can get pretty intense.
I was just thinking about that. It's a little bit intimidating, to be honest.
Hmm.
You're not just swallowing a pill. You're going into a different state of mind.
You're right. And the effects of psilocybin can be pretty intense. You might feel euphoria and connectedness. You might have visual hallucinations. You might even have a sense of ego dissolution.
Wow.
This is not something to be taken lightly. It really needs to be approached with respect and preparation, especially in a therapeutic setting.
Yeah, it's a far cry from just like, trying to have a good time or something like that.
Right.
This is serious stuff.
Absolutely. And in clinical trials, these experiences are very carefully managed. Participants go through a ton of preparation and psychological screening,
Okay.
and they have trained therapists there to support them throughout the entire experience.
So it's not just about taking the psilocybin, it's about the whole experience and having the right support.
Exactly.
That makes me feel a little bit better, honestly. But we also have to talk about safety, right?
Of course.
Anytime you're talking about something powerful like this, I think there are concerns.
You're right. We need to be upfront about that. The good news is that in clinical trials, psilocybin has generally been well tolerated. The most common side effects are headaches, nausea, and maybe some temporary anxiety.
Wait, anxiety? Isn't that what we're trying to treat?
It does seem counterintuitive.
Yeah.
But remember, this is a very powerful experience. And it's normal to have some anxiety during the session. But the important thing is that those side effects are usually mild and they're temporary.
Okay, that is reassuring. Are there any other side effects to worry about, more serious ones?
Well, there is one that we do need to discuss, and that's the risk of prolonged psychosis.
Good.
But it's important to emphasize that this is extremely rare in controlled settings where people are being screened and monitored very carefully.
So it's not something to be overly worried about as long as you're in the right environment under the care of professionals.
Exactly. They take a lot of precautions. For example, people with a history of psychosis, either personally or in their family, aren't allowed to participate in these trials. And the therapists are trained to recognize and address any signs of distress during the session.
That makes sense.
Yeah.
It sounds like they're doing everything they can to minimize the risks.
Yeah.
But, I'm sure some people listening right now might be thinking, okay, this is all fascinating, but I'm not going to go eat some mushrooms.
Right.
What would you say to them?
I totally understand that concern. And it's really important to understand that self-treating with psilocybin is incredibly dangerous and irresponsible.
Yeah.
This is something that should only be used under the guidance of qualified professionals in a controlled setting.
We're exploring the science and the possibilities here, but it's critical to be careful and responsible.
Absolutely.
This is a new frontier. There's still a lot to learn.
That's a great point. And that's one of the things that makes this field so exciting is that we're still in those early stages of discovery. There's so much more to uncover about the potential of psilocybin and how to use it safely and effectively.
Okay, I think that's a perfect place to pause for a minute. We've covered a lot of ground, from the history of psilocybin research to the importance of dosage and the safety considerations.
Absolutely.
But this is just the beginning.
Right.
When we come back, we'll dig deeper into the therapeutic value of the psychedelic experience itself and what makes psilocybin unique in its potential for treating depression. So stay tuned.
I'm excited.
Welcome back. Before the break, we were talking about how important it is to be responsible when exploring the potential of psilocybin and how crucial it is to have that expert guidance,
Absolutely.
especially in that controlled setting,
Yeah.
which actually leads perfectly into what I find the most fascinating part of all of this, which is the therapeutic value of the psychedelic experience itself.
Right.
So walk us through this. What actually happens during a psilocybin session in a therapeutic setting?
So imagine a comfortable, safe space, with trained therapists present.
Okay.
You'd likely be lying down, maybe wearing eye shades, listening to music, and you'd be encouraged to just turn your attention inward.
That actually sounds kind of relaxing.
It can be, but it can also be challenging. Intense emotions and memories might surface, and you might even feel like you're facing some of your deepest fears.
Okay, not so relaxing anymore.
Yeah,
Could be tough.
it can definitely be. But that's why the therapists are there to really help you navigate the experience and make sense of everything that comes up.
So it's like having a guide when you're spelunking through your mind.
I love that analogy.
Right.
Yeah, and that relationship with the therapist is such a crucial part of this kind of therapy.
Yeah.
They create this safe space for you to have those really intense experiences and to work through them in a meaningful way.
Makes sense.
Mm.
But how does all of this help treat depression specifically?
Well, one theory is that this experience can help break those rigid patterns of thinking and feeling that can be at the root of depression. It's like hitting a reset button on the brain,
Okay.
creating the space for new neural pathways and new perspectives to emerge.
Oh, I like that, hitting the reset button. Like you shake up the snow globe and you see things in a new light.
That's a great way to put it.
Yeah.
And there's research to back this up that shows that psilocybin can increase connectivity between different areas of the brain. And this can lead to more flexible and adaptive thinking.
So instead of getting stuck in those negative thought loops,
Right.
the psilocybin might help make new connections and see new possibilities.
Exactly.
That's powerful.
It is. And some researchers think that the mystical experience that people often have during these sessions is a key part of why it works so well for depression.
Hold on. Mystical experience. Are we talking about like seeing angels or having divine revelations?
Not necessarily. Although some people do report those kinds of things. It's more about a profound sense of interconnectedness,
Okay.
a transcending of the self, feeling awe and wonder.
So maybe more like a spiritual awakening of sorts?
You could say that. And research shows that these types of experiences have long-lasting positive effects on people's well-being.
Okay.
Increased life satisfaction, a stronger sense of purpose, even less fear of death.
Wow. So even if it doesn't completely cure depression,
Yeah.
it sounds like it could have a profound impact on how people view themselves and the world.
Absolutely. And those shifts in perspective can be a huge part of the healing process.
So this is all fascinating, but I'm also thinking about, the potential downsides.
Sure.
What about those bad trips we hear about? Could this be scary or even traumatizing for some people?
That's a valid concern. And it's important to remember that any powerful experience has its risks.
Right.
And the psychedelic experience is no different, which is why we keep saying it's so important that psilocybin is only used in a therapeutic setting with the right screening, preparation, and support from professionals.
So it's all about creating that safe and supportive environment.
Absolutely. Even if challenging experiences happen with the right support, they can be processed and integrated into really valuable learning experiences.
So working through those tough moments could actually lead to a deeper healing.
Exactly. It's not about avoiding those difficult emotions, but about learning to approach them with more skill and to integrate them into a more whole sense of self.
This all seems to come back to having that support and that guidance from those therapists.
It really does.
So how do the therapists actually help people get the most out of these sessions and make sure things stay on track?
The therapist's expertise is really crucial here. They're there every step of the way.
Yeah.
So first, they help you prepare for the experience.
Okay.
They help you set intentions. They help you address your fears. And they teach you ways to cope with anything challenging that might come up.
So it's like a dress rehearsal
Exactly.
for the main event.
And then they're with you during the session to provide support and guidance if needed.
What happens after the session?
That's when the integration process starts.
Okay.
So the therapists help you process the experience, they help you make sense of any insights or emotions that came up, and they help you think about how to apply those insights to your everyday life.
So it's not just about having this big experience and then forgetting about it. It's about weaving it into your life.
Beautifully put. Yeah, it's about taking that transformational experience and using it as fuel for real lasting growth and healing.
I'm so glad you brought up integration because it emphasizes that this isn't just about the psilocybin itself.
Right.
It's about the entire process and every stage of the process.
Yeah.
So you mentioned earlier dosage.
Yeah.
How do they figure out the right dose for each person?
That's a great question, and it's something that researchers are still figuring out. There's no one-size-fits-all approach when it comes to this kind of therapy.
So how do they even begin to think about figuring out the right dose?
Well, as we talked about, the type and severity of the depression play a huge role.
Yeah.
They also consider the individual's medical history, any previous experience they might have had with psychedelics,
Okay.
and even their personality traits.
So it sounds like a very personalized approach.
It is. It's as much art as it is science. And the therapists use their clinical judgment and expertise to guide the process.
Working with the person to find a dose that feels right for them.
So there's not like a strict protocol they follow. It's more about tailoring the treatment.
Exactly.
Yeah.
And that's what makes this field so exciting. It's a really dynamic and evolving approach that has the potential to really change the way we think about mental health.
It is pretty amazing. After everything we've learned, I'm feeling optimistic.
Yeah.
It seems like psilocybin therapy could offer real hope for people who are struggling with depression,
Absolutely.
especially for those who just haven't found relief with traditional methods.
Yeah, I agree. It's a really promising field with a lot of potential to change lives. But it's important to remember it's still early, and we need to approach it carefully and responsibly.
Absolutely. So I'm sure not everyone's thrilled about this whole psychedelic therapy thing.
Right.
There must be a lot of concern and criticism still out there. Yeah, absolutely. And it's really important to talk about those concerns openly and honestly. Some people worry that we'll see a repeat of the social and cultural issues that came up in the 1960s with the rise of psychedelic use.
Oh, right, like the whole turn-on, tune-in, dropout era.
Exactly. Others worry about the potential for abuse, people trying to self-medicate with psilocybin without proper guidance.
Yeah, that makes sense.
And of course, some people simply question the science behind it and argue that we need more research before we fully embrace these therapies.
All valid points.
Yeah.
So how do we address those concerns?
I think for starters, it's all about emphasizing responsible use and continuing to do that really rigorous scientific research. This new wave of psychedelic research is happening with a really strong focus on safety ethics and clinical rigor.
So this isn't just a bunch of hippies handing out mushrooms in the park.
No, not at all. These are very controlled studies, often taking place at universities.
Yeah.
With very strict protocols to ensure people's safety and well-being.
Okay, that's good to hear.
Yeah.
But what about those wider societal concerns?
Yeah.
How do we make sure we don't end up with those negative consequences?
Education and open dialogue are key.
Yeah.
We need to be having these honest conversations about both the potential benefits and the risks of psychedelics,
Yeah.
talking about using them responsibly, and about the importance of ongoing research to make sure these therapies are used safely and effectively.
Seems like it's all about taking that balanced approach.
Exactly. And it's also crucial to make sure that everyone has a voice in this conversation. Scientists, clinicians, policymakers, and the public. We need everyone at the table to make sure we're navigating this new frontier responsibly and ethically.
Well said.
Yeah.
Before we wrap up this section, I want to circle back to something that's been really intriguing to me,
Sure.
which is the role of the psychedelic experience itself in the healing process.
Okay.
I know you've touched on this before, but it's such a unique aspect of this therapy.
It is.
Can you expand on that a little bit more?
Yeah, sure. So the psychedelic experience is often described as this deep journey of self-discovery, this chance to confront your fears, and ultimately a path towards greater self-acceptance and compassion.
Almost like a rite of passage.
In a way, it is. And many people who go through this kind of therapy feel profoundly changed. They describe it as a true turning point in their lives.
So it's not just about treating symptoms, it's about transforming the person as a whole.
Yes. And that's what's so compelling about these therapies. They offer us a glimpse into the vastness of human consciousness and that incredible potential we all have for healing and growth.
This is mind-blowing. Before we all run off to find a magic mushroom dealer, I think we need to take a pause.
Okay.
When we come back, we'll explore some real-world examples of how this therapy is being used and what the future might hold. So stay tuned. Welcome back, Deep Divers. Before the break, we were talking about, those psychedelic experiences and how they could be like a catalyst for that real personal transformation.
Right.
But let's get practical for a minute. What's the current state of all this psilocybin therapy?
Yeah.
Is it something people can access right now?
It's a really interesting time for this whole field. While psilocybin is still a Schedule I substance here in the U.S.,
Right.
meaning it has a high potential for abuse and no currently accepted medical use, we're seeing a real shift happening in the landscape.
So it's not exactly mainstream medicine yet,
No.
but there's movement.
Exactly. What's really exciting is that the FDA has actually granted what's called breakthrough therapy designation to psilocybin for treatment-resistant depression.
Yeah,
That's a big deal
that's a big deal.
because it means that they're acknowledging its potential and they're speeding up the research and approval process.
Wow, that is huge.
Yeah.
What does that mean for people who are interested in this therapy?
Well, it's a strong signal that things are really changing.
Yeah.
Plus, there are a lot of clinical trials happening right now investigating psilocybin for a variety of conditions.
Mm.
Depression, anxiety, addiction, even helping people cope with end-of-life distress.
So it's not just theory anymore.
No.
There are real people receiving this therapy right now.
Absolutely. And the early reports are really encouraging. People are talking about lasting relief from their depression and anxiety,
Wow.
better relationships, and even a deeper sense of meaning and purpose in their lives.
That is remarkable. It sounds like it has the potential to really change people's lives for the better.
Yeah, it does.
But what about access?
Right.
If it's still a controlled substance,
Yeah.
how can people even get involved in these trials or receive this therapy if and when it becomes approved?
Yeah, access is definitely a big challenge right now.
Yeah.
And it really depends on where you live. Some countries like Canada are actually creating legal pathways for psilocybin therapy.
Okay.
But in the U.S., for the most part, it's limited to these clinical trials.
So for now, it's just a matter of kind of waiting to see how things unfold.
In a way, yes.
Yeah.
But the good news is that there's a growing movement advocating for change. There are organizations that are dedicated to research and pushing for those policy changes to make these therapies more accessible.
That does give me hope.
Mm.
So it sounds like there's a real groundswell of support starting to build for this.
Yeah, there is.
Let's play this out a little further.
Okay.
Let's say psilocybin therapy does become widely available.
Right.
What would that look like in practice?
Yeah.
Would our doctors be prescribing magic mushrooms?
It's highly unlikely that you'll be getting a prescription for magic mushrooms from your doctor.
Okay.
Because the experience really requires so much careful monitoring and support, it's more likely that it would be provided in specialized clinics or therapeutic settings.
So it's not as simple as just, taking a pill at home.
No, definitely not.
Yeah.
It's all about having the right environment and the expert guidance to ensure that safe and supportive experience.
This all sounds very futuristic, though.
Yeah.
Are we really talking about a world where psychedelic therapy is just like a regular part of healthcare?
I truly believe it's possible.
Wow.
But it's going to take time, research, and a real shift in how we view these substances as a society. We really need to overcome the stigma and fear that has surrounded psychedelics for so long and recognize their potential for healing.
It's almost like we need to reclaim them in a way and use them for the benefit of humanity.
Exactly.
So we're not quite there yet. What are some of those hurdles that we need to clear before this can really become mainstream?
Well, standardization is a big one.
Yeah.
Right now there's a lot of variation in how psilocybin therapy is conducted. We need to have some clear protocols and guidelines to make sure that it's being done consistently, safely, and effectively.
So sort of like a best practices manual.
Exactly. And we need to address training.
Okay.
We need therapists who have that specific expertise in this kind of therapy. It's not just about understanding the drug. It's about being able to guide someone through that really intense experience.
It seems like a whole new skill set.
It is.
Yeah.
It requires a unique combination of skills: psychological knowledge, spiritual sensitivity.
Yeah. And a real understanding of the psychedelic terrain.
You wouldn't want just anyone leading you on a psychedelic journey.
No, you wouldn't.
Affordability. I imagine that's an issue too.
Affordability is definitely another issue. Right now, it can be really expensive,
Yeah.
which makes it out of reach for a lot of people. So we need to find ways to make these therapies more affordable and accessible to everyone.
It's important that this kind of care isn't just for, the wealthy.
Exactly. And then finally, there's the ongoing issue of public perception.
Right.
We need to keep educating people about those potential benefits or the risks.
Yeah.
We need to dispel those myths and misconceptions and really create a more informed and balanced conversation around these therapies.
Shifting the narrative from fear and stigma to hope and understanding.
Exactly.
Wow. Well, we've covered a lot of ground today.
We have.
From the science behind psilocybin to those potential challenges and what the future might hold, this has been a true deep dive.
It has.
As we wrap up, I want to leave our listeners with something to ponder.
If psilocybin can change our brain patterns like that and break us free from those negative thought loops, what other possibilities are there? Could this be the key to unlocking some whole new understanding of consciousness and how our minds even work?
Wow, that's a profound question, and it's one that researchers are just beginning to explore. What's clear, though, is that psilocybin has this potential to not just treat symptoms,
Right.
but to facilitate deep personal growth and transformation.
Hmm.
It's a whole new way of thinking about mental health. It's
Yeah.
a recognition that true healing goes beyond just fixing what's broken.
Mm.
And it embraces wholeness and connection and a deeper understanding of ourselves and the world around us.
What a beautiful way to put it.
Hmm.
And on that note, I want to encourage everyone listening to keep exploring this fascinating world. This deep dive has only scratched the surface.
It really has.
There's so much more to learn and discover. Thanks for joining us on this incredible journey, deep divers.